Bismillahirrahmanirrahim. So this is our third lecture in the short course of wound management, and in this lecture we will discuss about the healthy wound tissues or regenerating wound tissues. We have discussed in our previous lecture that wound is actually a damage to the tissue and extracellular matrix, and in a wound healing process there is a replacement or regeneration of those damaged tissues and extracellular matrix, and this replacement of damaged tissue with the healthy tissues is happened only with extracellular proteins, fibers, collagen, glycosaminoglycans, and cross-linking of these fibrous protein. So uh, uh, we have to keep in mind that there are only two healthy tissues that form in the process of wound healing process. So in this lecture we will discuss how these healthy tissues are formed and what is the secret behind for the healthy healing process of any or every type of wound. So the first healthy tissue that I have already mentioned in my previous lecture, that the first healthy tissue is granulation tissue. Granulation tissue is formed in the third phase of wound healing process, which is a proliferative phase in which fibroplasia and epithelialization happens and form a healthy tissue, which is a granulation tissue. So, we have to keep in mind the picture of granulation tissue. So, whenever we encounter any type of the patient who have a wound, so we can understand clearly that it's in what phase of the healing process and what should we need to do for the next proper healing process. So, granulation tissue is formed by new connective tissues and microvessels. The connective tissue like collagen, elastin, glycosaminoglycan, which are actually formed present in the dermis, and the new blood vessel which form due to angiogenesis process, they all collaborate and form a healthy tissue, which is a granulation tissue, which is named as granulation tissue. Granulation mean they have a fine little granules type like structure, and they deliver oxygen and nutrient to the wound area, and it is a light pink or red in color and moist in appearance, and it is a sign of clear wound healing process. So the in any or every type of the wound, when the wound starts healing, the first phase is hemostasis. In the wound healing process, when the blood clots form at the wound surface, the second surface is inflammation, when our body starts to remove all type of bacteria and pathogens from the body, and the third phase is the proliferative phase, in which our body or skin structures proliferate to form a new healthy tissues, and to repair the wound or to replace the damaged tissue with the healthy one. So the healthy tissue is a granulation tissue which provide nutrient and oxygen to the wound surface, and it is light pink or red in color, and it is moist in appearance, and it is formed with new connective tissues and microvessels. So this is the definition of granulation tissue, and it will be more understandable whenever you will encounter any type of the patient in real life. So after the granulation tissue form, the epithelial tissue starts producing from the edges. Like this is the edge of the granulation tissue, and from this edge, epithelial tissue starts producing and migrating to, and it epithelial tissue closes the wound surface. Like in this picture, it was actually a this whole type of the wound. It will be like 3 into 6 centimeter wound, radial wound, and after the formation of granulation tissue and epithelial tissue, the wound size shrink into 3 into 4 centimeter. So with the help of the granulation tissue, the wound starts shrinking and the wound closes with epithelial tissue. With epithelial tissue, and epithelial tissue is a healthy tissue, and it closes the wound, and after the epithelial tissue closes the wound, the melanocytes produce at the surface like this, the little bit dot of pigment shows that melanocytes are migrating towards the surface and to give the color to the wound surface. And melanocytes happen in the last phase of the wound healing, which is the remodeling phase. So whenever there is any or every type of the wound, like in this picture, this is a wound, and doctors have to prepare the wound bed with sometimes with autolytic debridement, sometimes with mechanical debridement, and there are many steps of the debridement. It's totally a choice of the doctor. Whatever the way he chooses to prepare the wound bed. But the best way and is to prepare the wound bed is to moisturize the wound repeatedly. So the unhealthy tissues are like this, yellow in appearance. These are unhealthy tissues, and I will discuss in next lecture. The unhealthy tissues are usually removed with repeatedly moisturizing the wound surface, and when unhealthy tissues gets removed, the healthy tissue, granulation tissue, appears, and this granulation tissue is a sign of healthy tissue. And after granulation tissue appear, the epithelial tissue starts migrating and it closes the wound surface. And after the epithelialization happens, the melanocytes migrate to the surface and give color to the wound. So in this picture, it was actually the skin color, and there was a wound. A granulation tissue was formed in the history, and then epithelial tissue. Epithelial tissue is usually light pink color. Epithelial tissue has covered the wound surface, and now the pigment will appear, and the pigment will appear in usually 1 or 2 years process. Again, this is the granulation tissue, and from the edges, the epithelial tissue starts migrating to closes the wound surface. So, in this lecture, we have to keep in mind that in any or every type of wound, there is a damage to the tissue and extracellular matrix, and in the wound healing process, there is a replacement or regeneration of those damaged tissue and extracellular matrix. Replacement happens with granulation tissue and regeneration of the epithelial tissue. And while wound healing process, and there are some unhealthy tissues which we will discuss in our next lecture. But we have to keep in mind that there is only two healthy tissues. Number one is granulation tissue, and number two is epithelial tissue. So for example, there is a child who fell into the street, and there is a big wound in her knee. And when you encounter the child, the child says that my wound happens 7 days ago, or like 10 days ago, and there is a big appearance of the pink and light red in color wound, which is moist in surface, and the edges are like light pink in color. Then what do you will say? Sometimes, like when I was doing my internship, I at the first glance like it's a dermis which is pink and light red in color. But later on, my teachers realized me that you have to keep the history for how sorry for the interruption. So I was saying, like when I was doing internship, I used to say to the my teachers, like if the dermis is pink in appearance, when if we remove the epithelial tissue from the normal healthy skin, the dermis usually appears in pink in color. But my teacher stated that you have to take the proper history of the wound, for like how old is this wound. If the patient say, let's say like it happens yesterday, then will be a dermis. But if the patient say that it happened 10 days ago, then it will be clear that it is a granulation tissue, and we are waiting for the healthy epithelial tissue to cover the wound surface. So I hope so it is clear, and thank you so much.